Hi, everybody, and welcome to At the Table with CASA, presented by California Association for Health Services at Home, with support from Heffernan Insurance. Heffernan Insurance is proud to support home-based care providers across California, helping agencies protect what they've built and navigate today's increasingly complex healthcare environment. My name is Mark Wilson, and every week on this podcast, we bring you real conversations about important policy issues that CASA is moving on, and also, hopefully, some practical strategies that are shaping home care across California, and some very interesting people, like CASA's own Director of Membership, Tricia Smith. Hi, Tricia.
Good morning, Mark. How are you?
I'm good. It's you and me today.
Just us.
Just us at the table. So yeah, thanks for showing up. I want to ask you about Lobby Day, which I know just happened a few days ago. But before we do anything, I want to kind of level set this podcast um, as to what it's about. This is a place where we want to talk about what providers are actually dealing with. So it's not a PR show. It's not a big marketing thing. It's not a spin show. Because I think right now, in California, there's a gap between what's being said publicly and what's actually happening on the ground. And if we don't work to close that gap, we're not really going to be helping anyone. We're not helping providers. We're not helping patients. We're not helping families. We're just not helping anybody. So this particular show is about pulling up a chair and having the conversations that matter, even if they're a little bit uncomfortable. And on this week's show in particular, we're going to address one of the probably the most uncomfortable issue facing home-based care right now, and that's fraud. Do we talk about it? Do we not talk about it? I think we need to maybe provide a little bit of guidance on how to handle things, perhaps in a different way, so that we can change the narrative from negative, I would dare say, to the positive. But before we get into that, Trish, I heard y'all storm the steps of the Capitol in Sacramento.
We did. On Tuesday, the 14th, we had our annual lobby day. And what was really exciting was this was our first day back in person that we had done since before COVID. So our prior lobby days over the last few years since COVID have been virtual. And this was the opportunity for us to finally do it again in person. One of the things that
Nice.
we're making about CASA 3.0 is getting back out there and meeting with our people and our legislators too. So we had the opportunity to, I think we had well over 40 visits with legislators. There was a decent sized group. I mean, it was considered small, but our first year back, we had a little over 20 people, and then we were split up in groups. We went out to meet with legislators across the state in their offices at the Capitol. And what was the interesting part is I had not been there since they started all of their construction. And so I'm a little bit older now too. And the walk and thinking I could do it in heels was a little bit challenging.
I
I have kudos for those people that go up and down the stairs all day long because the
Right.
elevators take too long to wait. And it was
Yeah.
literally refreshing yourself kind of going through that process of going
Yeah.
through security and waiting in line and doing all of that. And, you know, I have to say, with everything going on in the world, and I know people who do this every day may not feel the same way, but getting a chance to participate in our process is something that's encouraging. You know, that the way that this country was built and how we're able to advocate and have those grassroots efforts, it's just it's motivating, it's inspiring. And whether or not they listened or didn't, you know, I did something about it. And I think that's the part that was for everyone that was there. They felt it was so rewarding and they felt like they were using their voice for good. And it's not just for us as the providers out there or our members, but really at the end of the day for our patients, our families, and their communities. For the bills that we're supporting, and we got good traction. And I mean, there's three out there that we're working on, and that's AB 2096, and that's the respiratory care bill, basically allowing LVNs to work within their scope of practice and provide respiratory services that they're used to doing, but really just kind of straightens out the language and the legislation piece so that that can be allowed. AB 2081, which is the home and community based waiver expansion program, which allows us to be able to add more individuals that they can see. We have a 3-year waiting list at least right now for individuals wanting to be part of that program. So basically what this is doing is expanding that ability for us to take on more patients for our members to be able to serve them. We have a lot of great programs out there that are doing a lot of good. So was excited to hear the interest in this. And then our AB 2240, which is our private duty nursing bill. And the stories that the folks told on this situation, I think brought tears to the room. Most of the folks that are recipients of these services are children with complex medical issues that want to be cared for at home. And this bill would allow basically to create private duty nursing as a specialty for Medi-Cal funding that would allow patients or kids to be able to be at home with their parents and their parents to actually be parents, not just caregivers, and to see the progress that some of these kids make when they get to go home and they are able to have these services. It's critical. I get a little emotional just thinking about it, and I know I haven't even shared the stories with you, but it was a very good day. It was recharging, it was motivating, and it felt good to be part of the process. Excited about next year. The group did a great job putting the event together, and I think everyone that participated was really excited.
Just to give us a sense of how you were received by the people that you talked to, because I know sometimes in my experience, and I've done the Washington D.C. trip a couple of times. Depending on who you're talking to, they can be rather dismissive, like they're not really even listening. So, can you give us a sense of
Yeah,
what kind of?
most of our meetings, I think there were some meetings I think they had with members, but most were with their aides in their office. And they surprisingly, as young as they seemed, and I can say that because I'm old now, is so well informed and educated, more so than I even remember when we used to do it years ago.
Yeah,
That they really kind of understand. We brought up some of the bills and they said, wait a minute, we had one like this before. And so they were very much attentive, even if we're meeting out in a hallway, because their offices now are so small in this swing space that they're in. And yeah, and it was, I felt we were well received. I don't think that many of our members felt like they weren't being heard. And honestly, I mean, our issues aren't political. Yeah, they have budgetary consequences, and that's where the politics come to play. But at the end of the day, taking care of people the way they should be taken care of shouldn't be political. It should be bipartisan, and we shouldn't have opposition to a lot of what we do.
Is there anything you think that CASA members can do to help support what you folks did in Sacramento the other day?
Absolutely. Reach out to Tanya Batista. She's our director of policy. She can give you information on the language of our bills. Actually, what all of us as providers, when I was a provider too, is reaching out to your local members that are in your community. Develop those relationships. Invite them out on home visits. That was one thing that we used to do too, is invite them out on a home visit. Have them understand truly what our services are about and how critical they are. Because again, I think healthcare is going to be at home. The more that everyone wants to be at home, and so to
Sure.
have our members of the assembly, our members of the state senate, and then our congressmen and our state U.S. senators to understand the true importance and criticalness of what our services are.
Awesome. Well, thank you for doing that the other day. I wish I could have been there myself.
Yeah, I don't know. You might need a wheelchair.
I can't get up steps.
I felt like I almost did.
And you know what? This is perhaps then the sort of the theme of this particular show, this podcast today is, turning negative into a positive. So I want to, again, I want to talk a little bit about fraud today. It's certainly been in the news enough. And for credibility's sake, some of you that know me know that I've been in media and marketing for my entire career, 16 years of it in home-based care, home health and hospice, and a little bit of private duty. So I bring a certain knowledge and experience to this subject. And let me set it up by saying this. Here's the reality of the situation. If you're not telling your story, someone else is. And right now, guess who that is? It's the media. And unfortunately, the story is being driven by fraud. And the fraud now, I just saw a report the other day coming out of LA. They busted I don't know if these numbers are real. They sound like too many, 400 and some odd hospices.
Well, some of these investigations are not new, though. So that's the whole thing is I think people are paying attention now, but I think a lot of those investigations were already underway to be able to they take years to
Of course.
go through the process. So walking in and just shutting down doors, unless that's a new thing that they're doing, usually isn't the case. They are working with, unless you see blatant, obviously, and there is blatant situations that are occurring down in Southern California area and so forth. But I think they're using it as a headline where we've been complaining about these issues for years. I
Sure.
mean, one of the reasons why when I was a provider, we exited the Southern California market because not only was there so many agencies, but the amount of non-compliance or fraud amongst some
Yeah.
of the members down there made it difficult for those of us that were doing it the right way to compete.
And unfortunately, they set the tone with some of the referral partners as well down there. So
Exactly. Exactly. And it has two-pronged consequences in that regard. You have the referral partners that are used to doing business with those that aren't doing it appropriately. When you would walk in to meet with the doctor or whatnot, and they would say, you don't have Laker tickets in your front pocket, don't come and see. I charge $500 for a referral. Those types of things, we wouldn't even, I mean, okay, then we don't take we don't want your patients, that type of thing. But then you have the good providers out there that are scared because they don't want to be caught in the crosshairs, and it's from a referral standpoint, and they like, no, well, I'll just send my patient to the hospital. I'm not going to deal with this home health hospice crap. I don't want to get in the middle of it, and I don't want, because they're seeing doctors arrested now too.
I know. Yeah. The fact of the matter is that, this sort of started, it seemed as a hospice thing. And now, according to the report I saw on television yesterday coming out of LA, it's hospice. They're busting home health agencies. They're busting private duty care. So everybody's under scrutiny. And here's the thing, folks, media is doing its job. Okay, they aren't always fair, but they're doing their job. Regulators are doing their job. I think, and this is kind of the message for the day, and we're going to provide a little bit of guidance on this for you. Providers also need to step up. We need to step up. You need to step up, because the only version the public hears is the negative one. And from my point of view, perception becomes reality if you don't step in. So the shift, I think, has to be this. And I get it. It's like we look at these reports and we go, it's just, it's just awful. You kind of want to hide. I think our response needs to be, we don't want to respond to this kind of stuff. We want to start thinking about leading. So start thinking about a way to have productive conversations. I mean, how many times has the media over the years even mentioned hospice or mentioned home care? So this becomes for us an opportunity to talk about what we do and to say to people, literally, we're glad this is happening. We welcome this kind of accountability. We don't need to be defensive. We need to say we welcome accountability. We support the oversight. And by the way, here's what great hospice care actually looks like. Come in and find out that's a completely different posture. That's what I think leadership is. And I think we need to leverage this opportunity.
I don't disagree. I think that from an education standpoint, this is an opportunity why we have kind of an ear,
Yes.
willing for people to listen to us, that there are the agencies out there that give amazing care, but maybe they've had staff changes or whatnot, and they're at risk potentially for some of these audits that are out there. I mean, we were at risk. We were part of a data inquiry, and that drove some of, I mean, it can, if you're not prepared for that, that can drive legal costs and all of that stuff to where it puts an agency out of business. I mean, they're extensive, but it doesn't mean that you're a bad actor either. I think that there's opportunities there that we have to be willing to expose ourselves for, to say, look, how can we do this better if something isn't exactly in place from a documentation standpoint or a knowledge standpoint. I think the scary part that I've seen over the years is agencies rely on other partners or other input to tell them how to be responsible for their agency, and they don't necessarily always know that what they're doing is not right.
Right. Exactly.
There's a difference between that, even though what they're doing may not be right and it's still not okay, but it's between those that are actually intentionally taking money for or paying people for their beneficiary numbers and billing for services that have never occurred.
So let's get practical about this, because just talking about the problem isn't enough. Again, this, I think, is an opportunity for us, for you as providers, to be able to tell your stories. And quite frankly, I think the media is looking for it. So where do you start? I will tell you that CASA, we're going to be reaching out to a set of media people, media platforms rather, that are fairly large, and trying to position ourselves with this kind of message like, hey, we're all seeing the reporting and we're not disagreeing with it. We're not being defensive about it, but there's another side to this. There's a part that's been missing. So we're going to be fighting that good fight. But folks in your own communities, where your agencies are, you can do the same thing. And you may not know where to start. Where do you go? So we want to provide a little bit of guidance on it in this particular podcast. And again, I spent my entire career in media, on media, doing media, succeeding in media, failing in media. I got all kind of experience in media. So I know what they're looking for, and I know what they're going through. So let me give you the first thing here that I think you need to do. Number one is make sure you own your message. Know who you are. You need clarity about what your agency is, who you are, and why you are. Vagueness like our hospice nurses are just great. That's not enough. That doesn't work. You need to define who you are. Tell me specifically how you create value for patients. And don't use a bunch of clinical jargon. Be a real person. Keep it simple. How do you create value for families, for referral sources, and for the healthcare continuum at large? Talk about outcomes. Tell me stories I can relate to. Do not market to me. I don't want to hear marketing messages. I want to hear simple, clear messages about who you are. I will tell you, lots of agencies, and maybe you're one of them, lots of businesses, period, have these long, boring mission statements that they have no idea what they mean. They're 3 paragraphs long, and they talk about, being dignified and our intention to, and they don't really mean anything. And one of my favorite clients along the way had a very simple mission statement, and they spent a lot of time on it. And I believe they started with one of those 3 paragraph statements. And the secret was, if you could go down the hall and point to somebody and go, what's our mission statement? And they can't tell you, what is it worth? So this particular organization, like I said, they spent a lot of time on it, and they came up with, at the end of the day, this was the statement: we help people live a better life. That's it. It's simple, it's clear, it's repeatable. People understand it, and it was something that you could apply to everything that they did. Clinicians, when they put, a question through that funnel, knew what to do for patients. We helped them live a better life. I'll give you another example, and this is one of the best examples of messaging and a mission statement I've heard. It wasn't even a mission statement. It was just something that they said for a hospice, and it was this: dying happens on the last day. Every other day is about living. When you set your conversation up, when you jump from that starting point, dying happens on the last day. Every other day is about living. You have a lot of conversation to have, and people tend to get it. Well, wait, yeah, you're right. Dying does happen on the last day. What hospice does is makes every day before that better. It's CASA's job, but it's also your job on a local level to make sure that people do get it, to make sure that they understand it. I'll tell you one other thing. Ask yourself this question. This is something I do with clients. I've done it for years and years, and I don't care who the client is. I don't care what business that they're in. Ask this simple question. If your agency were, God forbid, to be gone tomorrow, what would people miss about it? What would people miss about you? Now, I'll tell you that the answer that I get, or that I used to get quite a bit, was, well, they'd miss our nurses. Well, that doesn't work because there are nurses at other agencies. Well, they'd miss our great care. Well, great care is available at a lot of different agencies. So what it does is it forces you to drill down on who you really are and why you do what you do. And you will get to a point, if you do this, hopefully you get to a point where you come up with, we help people live a better life, or dying happens on the last day. Every other day is about living. But anyway, so the most important thing you can do is own your message, get some clarity if you don't already have it, and drill down on that. The second thing is get in front of the media. The media is already there. They're in front of us. Don't wait to be called. Reach out. Offer a different story. Invite reporters to see what hospice actually looks like. Invite them in. Introduce them to your team. Share stories is the best thing you could do. Patient stories, if you're allowed, if you get permission, of course. Don't just, we all know the HIPAA rules, right? Right? By the way, something else that CASA is going to be doing, if you'd like to get some of this stuff, all you need to do is email us at info@casa.org. just a few tools, some email templates that you can use to send out to media, some talking points that you can use, just stuff that'll help support what you're doing in your local communities. And keep in mind, media doesn't always respond. I mean, we're going to be sending stuff out to LA Times, Politico, and a few other large media organizations, and they may not get back. So you have to continue to bug them. At any rate,
Can they reach out to you for how to contact them or how to?
yeah, yeah. As a matter of fact, I'll take that a step further. I'll offer, some of my time. If you want to have a conversation with me, I'm more than happy to do that. You can just get in touch with CASA, info at CASA, or call, and they'll set you up with me. I think that's the best way to do it. What do you think, Trish?
Yeah, that's probably the easiest way. Or reach out to me, membership, if you're interested in information on how to contact media, what kind of language, or any other consultative advice that Mark wants to provide for you for free as a membership benefit.
Yeah, yeah, and I don't mind. I mean, I'm not going to spend hours and hours and days, but I would love to talk to anybody who wants a little bit of help, a little bit of guidance in what to do. So just, yeah, reach out and very happy to help. Number 3, I don't want to take too much time here. If you aren't already doing it, create content. Get your get your iPhone out, turn it on, point it at yourself, and say a few words. It doesn't have to be fancy. It doesn't have to be complicated. One person, one message, do 30 to 60 seconds, do some audio content. Don't worry about looking bad, because I tell you what, I think I said this earlier in the podcast, people don't necessarily want to be marketed to anymore. Authenticity is huge right now for people. They want real people, real stories, authentic people, not a
And
bunch of
honestly, on the social media content, the content that's out there, like and share your colleagues' information too. Get out there, connect with your colleagues, even if they're competitors to some degree. The more we like and comment, the more the reach expands. And from a collective voice standpoint, more people will become aware of what we do as an industry, and we become stronger as an industry for that.
And again, that's the theme of the show today, taking what we've seen now, negative messages over the last couple of months, turning it into a positive and multiple voices. I mean, that's what CASA is. It's multiple voices, multiple people, one voice.
One voice.
Sorry, I got that wrong. Anyway, so get some content done. Don't worry about scripts or being really polished. Just be real. Be authentic. Authenticity wins the race here, folks. And the more of you that are out there sharing these messages, as Tricia said, the more people are going to see it, and the more people will understand. Number 4, communicate with referral partners. Don't assume that they're not paying attention, because they are. They always do. Send them an email. Make the call. Acknowledge what's happening. Don't hide from it. And reinforce who you are, right? That makes sense?
Yep. Make sure that they understand the issues and what's really going on, because even though they are not directly involved in some of this, they don't want to be a part of it either, as
Yes.
far as they want to distance themselves from that. And at the end of the day, that means your patients suffer because they're not getting the care that they should get if they're not getting referred to the right type of.
So again, the message is don't assume. Don't assume that they're not a little concerned, that they're not worried, that they don't look at they don't know as much about you as you think they do. That's the message I'd like to give you. I've worked with countless account execs, marketers, call them what you want these days, salespeople, and I can tell you the one common thing with everybody is that we all sort of believe that our referral partners really truly understand what we do and are thinking about us all the time. They're not. Communicate. Confidence builds trust, and silence. If you're not addressing it, the silence can erode that trust. So don't be afraid to have the conversation and to make sure people know who you are. 2 more things. Train your team. Everyone on your staff should be able to answer one simple question. And it's the question I asked earlier. If your agency were gone tomorrow, what would people miss about it? How does your hospice or your home health agency or your home care agency create value, real value, for patients and families and referral partners and the healthcare community in general? Your frontline team are your most powerful storytellers. I will share with you that most of the great stories that I've ever told for home-based care businesses on video or anything else came from a frontline employee, a nurse, a physical therapist. They know those great stories. So ask them, ask everybody. and then put them to work for you?
I mean, we have some simplest, I mean, there's heroic and amazing stories that'll bring you to tears, but even some of the simpler ones, having a hospice patient who had one of our aides taking care of the hospice patient, and she saw this Afghan on the ground that was partly started, and the aide asked the patient, "What are you working on?" She's like, "Oh, I was working on that to give as a gift from my granddaughter, but I'm worried I'm not going to be able to finish it before I pass." And so that aide was very, very talented in regards to her ability to crochet, took that home and on her own time finished it for her so her grandmother could give it to her granddaughter before she passed. I mean, those kinds of things. It's like the human things that make everything about what we do is more than just, medical care. It's people taking care of people and helping them live a better life and all of those things that really matter.
And that's why that story is always going to be better than a brochure that goes line by line about how great your agency is. Trust me on this. Trust me. Keep in mind, y'all are doing tremendous work. This moment that we're going through at the last couple of months with all the negative press isn't comfortable. But you know what? And this is me. I think it's necessary. And for those who are doing the work the right way, it really is an opportunity. It's an opportunity to get involved, use your voice, work with CASA. I mean, we've got all kinds of ways to support you in your effort, but it's an opportunity for us to educate, to build trust. Hospice in particular, we all know, at its core, it's one of the most compassionate services in all of healthcare, and it deserves to be understood that way. So don't wait for the narrative to fix itself, because it ain't going to. Step into it, shape it, own it, because the patients and families who need you are really counting on it. And again, rely on CASA.
Reach out to me if you're not sure where the question needs to go, if you're interested in membership or what the membership would include, or you have suggestions on how we can improve. That's what we're about. We're all kind of all hands in working together. We're a small team, but mighty. Just really excited about the way that we're moving forward and the way that we can support all of our members and the home health and home care industry.
And don't forget, we have a conference coming up. You want to be at that.
Yes.
It is.
It may sound like it's the same because it's in Rancho Mirage again, but we're really bringing the heat this year.
Yeah, no, I always enjoy the conference. It's, you learn a few things, you see some people, you get to do the networking thing, but it's educational and it's fun, and you get to eat pizza provided by the, Heffernan Insurance.
We've got our 60th anniversary party this year, along with a new PAC casino night. We have a lot of different activities. Matter of fact, I just sent out an email to solicit for affiliate advisory partners to be part of a committee to help make our expo hall and activities better there. We're really taking input from our membership. So we want this to be like it used to be and even better. And we're moving in that direction. Really excited. Registration's open. Go to our website. You can pull up registration if you want to exhibit. There's opportunities there as well.
I love the new CASA 3.0. It really does feel different. Not that the CASA 2.0 and CASA 1.0 weren't good, but it just feels very energetic right now. And I like that. Are you guys planning any more other tours, lunch and learns?
Yes, I believe we have one coming up at the end of the month. We're doing a virtual listen and learn session to capture more input. We did the live tour at the beginning of March, and then we're following up at the end of this month. You can go onto our website and register for that event too.
Okay, great. All right, y'all. Big thanks to all of you for listening and for the work you do every day to care for patients and families across California. If you'd like to drop us a note about a topic you'd like us to discuss or anything else you'd like to let us know, you can email us at info@casa.org. That's info@casa.org. By the way, next week, working on a very special guest for the show. I can't say who it is because I haven't confirmed it yet, and he might get a little upset if I mention his name today. But you're going to want to be with us next week. And thank you, of course, to our presenting sponsor, Heffernan Insurance, for their leadership and great support of California's home care community. New episodes of At the Table with Casa drop every week. Subscribe, share it with your team, and please be part of the conversation shaping home-based care in California. Thank you, Tricia. Always good to see you at the table.
Thank you, Mark.
My name is Mark Wilson, and remember, this is your seat at the table. For everyone at Casa, we'll see you next week.